Introducing the all-new Italiano range of pizza. Pizza Ultimo. Pizza Hut.
Health services point out that complications can be avoided by seeking immediate medical attention once symptoms of the influenza A virus are detected. Director of the Epidemiology Unit of the Ministry of Health, Dr. Paba Paliyavadana, said that expectant mothers and children should take adequate precautions in this regard.
Doctors say that high fever, difficulty in breathing, cough and chest pains are the symptoms of this virus.
Influenza is a respiratory infection. It is a common infection in our country, but it's a normal viral infection which disappears within 3 to 4 days, and many people, a large percentage of people won't get any complications, but rarely in vulnerable groups such as in pregnant mothers, elderly people, those who have chronic illnesses, and then in small children and in infants, this infection may lead to complications.
Speaking on News First, the director of the Lady Ridgeway Hospital for Children, specialist Dr. Ratna Sirihevage, said that 5 out of the 19 samples that were obtained from the 18th of April and sent to the Medical Research Institute tested positive for the influenza A virus.
I want to emphasize the parents of the children. If your child has a influenza-like illness or what is called, cough and cold, better to take the proper medical treatment rather than trying various remedies, home-based remedies.
Recently, 2 women died at the intensive care unit at the Castle Street Teaching Hospital after contracting the influenza A infection. The director of the Castle Teaching Hospital, Dr. W.K. Vikramasinghe, said that another 10 mothers suspected to have been infected with influenza A are receiving in-house treatment. One of the mothers has been directed to the special treatment unit. The director of the hospital added that the intensive care unit of the hospital has been temporarily closed. Meanwhile, Director General of Health Services, Dr. Palitha Mahipala, commented on the situation at an event held today. From time to time, infections can occur at the intensive care unit in a hospital. Sometimes a death may also occur. At that time, what we do is we temporarily suspend activities in the ICU. When such a situation arises, according to medical science, we appoint a committee comprising of intellectuals to look into the matter and make recommendations. Their recommendation was to separate the patients who are diagnosed with these infections and identify a solution. The strain of the influenza virus that is spreading is yet to be confirmed.
Recently there has been an outbreak of influenza A. Influenza A virus has several subtypes, and sometimes when it spreads across every year you get a different influenza subtype, and sometimes when it spreads across the world it's called a pandemic. So it's important not to panic, but just to be aware that there are things like this, and all the relevant authorities are taking the necessary measures to see if there is any issue and taking the necessary steps for treatment and handling the situation. So there is nothing to panic, but it's just to clear what this infection is.